So, Rebecca, if you wouldn't mind introducing yourself and telling us a bit about what your career is.
Yeah, of course. So I'm Rebecca. I work currently in Coventry CAMS in Core CAMS. I am a very recently I have been working there as a CAMS practitioner slash drama therapist, but very recently I have changed roles and now I am the drama therapist for the team in Coventry, which is really exciting because I get to just fully use that in my day-to-day kind of profession, which is really exciting. So drama therapy, I'm not sure a lot of people have kind of heard of it, but perhaps don't fully know kind of what it is. I know a lot of people have probably, heard around kind of like art therapy and creative therapies. So it falls under that umbrella. Drama therapy is a type of psychotherapy, and we are registered with HCPC, which is Healthcare Professionals, and also with BADFA, which is the British Association of Drama Therapists. So that's kind of the umbrellas that we fall under. So we can work with a wide variety of clients. So obviously, children drama therapy can work really well with. It can also work with adults with learning difficulties. It can work with. I've had experience of kind of working with patients with dementia and also patients with brain injuries as well. It can be really kind of a good piece of work to be able to use with a wide range of clients. Um, so just to give a little bit of introduction of what drama therapy is, it's kind of a similar to art therapy, really. It's a form of psychotherapy that uses drama materials and art materials to help people to express themselves in that space. And what I really love about having that in the core team in Coventry is kind of a real alternative form of therapy from CBT and that sort of thing. It's kind of a different approach, which I think is really important for young people to know there's an access of different sort of therapies that are available to them, because one box doesn't fit all, and I think it's nice to be able to have that flexibility within the team. And certainly I work with a lot of young people that perhaps want to work on their mental health but don't know how to express themselves or don't know how to speak about that. So drama therapy allows a lot of distance in that space, so we can use materials such as art materials or mask work. A lot of the time I can bring in story work if there's a certain theme. For example, if there's something like bereavement, we can pick a story that might look into things around that theme to allow that young person safety to be able to work on that within the space. So it does give that opportunity. We can do things like role play and certainly kind of like embodiment and that sort of thing, and bring like scopes into the room as well. I know that a lot of the young people that we work with, sort of adolescents within CAMS, sometimes get a bit worried around the word drama, meaning that they're going to have to come into the space and they're going to have to just stand up and do some acting, which isn't the case at all. It's kind of just very flexible. And I've kind of had a lot of questions asked, is it, I've had even before, if it's like therapy for actors, which was quite a funny one to hear. But yeah, it's kind of very flexible, that it can be really helpful for people that have an interest in kind of being creative, but need that kind of distancing as well. Um, so a kind of day as a drama therapist would look like, coming into clinic and setting up the room. So the room, the art therapy room that I work in, has got lots of different materials and lots of different things that we can use in that day. So just making sure everything's kind of available and ready, because a lot of the time, whilst it's structured, we do allow flexibility, so young people can come in and choose what they want to work with, which I think is really great to offer them choice as well. So usually I will sort of plan my sessions in the morning, maybe do some admin work, and kind of just make sure that I've got all my sessions planned for the day, all my notes are up to date, and just make sure if I need to do any orders for any materials that we need to order in. Then I'd probably see usually about 3 or 4 clients in a day, so that would probably be an hour session, with then writing notes up in between, and just making sure that that space is kind of like cleaned each session as well. So how a session usually would look like for a drama therapy session is we'd have like a check-in just to see how that young person's week had been. And then we would kind of move into maybe something like a game or an activity, or just something that's really kind of distance, not focused too heavily on kind of any stuff around mental health, just something to help them feel like they're in that space and they're comfortable. And then we'd move on to like the main activities. That could be a bit of artwork, that could be, sometimes that young person will just want to speak in that space. That's also fine. They don't have to just kind of do art all the time. They might just feel as though they want to use that space to talk. So we'd often then, work on whatever kind of piece of work that we're doing in that space. And then we have like a bit of reflection time at the end. We come away, we might look at that image or look at that creation that we've put together and kind of see if we can draw any connections to any emotions or feelings connected to that. So that's kind of what it would look like in a session. So kind of how get into a professional drama therapy. So it's a master's degree level drama therapy with having to kind of do a BA before. So I originally did my undergrad in drama, mainly because I didn't know what I wanted to do at uni, and I really enjoyed drama myself. It helped me quite a lot with my confidence and just having a space to be able to express myself in a different way. So I did drama as my undergrad, and then we had somebody come in and do kind of a session on drama therapy, and I thought it was amazing how we could utilize the skills in drama to be able to actually help people. And so I was kind of really interested in kind of doing that. So I went away, and they really encourage you before the course to get a few years experience of kind of working in different environments with different with different kind of caseloads and that sort of thing, and building up your experience within that before actually applying for the course. The course is a 2-year course, and I studied at the University of Derby. I think there's not hundreds of courses that do it in the UK. I think there's about 5 or 6 now that you can register to do the masters. But the masters is great. It's a 2-year masters, and a lot of that is quite practical. So you'll go on placement, and you also have to kind of go through your own therapy as well, which I didn't really think that I needed at the start. And at the end, it was something that I couldn't really live without now, because it's something I think as a therapist is really important as well, to be able to have that space. And that was something they really encouraged during the masters as well. So yeah, I kind of graduated, and then it's kind of building up your experience then. And I think it's something that is when you first look at jobs for drama therapy, like they don't always come up, and there's not always hundreds that you can find. I think it's something that still is kind of growing, but it's growing quite fast. I think alongside arts therapy, music therapy, it's something that we are working really hard to kind of get a voice out there for, and I feel quite passionate about that, because I think there is a massive need for it, with young people, and with lots of different client groups as well. So but I think once you can kind of get that experience, and sometimes you might have to be under the umbrella of a CAMHS practitioner or a mental health practitioner, but actually that still allows you to be able to kind of gain that experience. And yeah, there's lots of opportunities working in charities, in schools, as I said, NHS. I'm seeing lots more jobs now available in the NHS for drama therapists. So there's lots of different opportunities for different places you can gain experience. So yeah, that's a little bit of an overview, an introduction to drama therapy.
Fantastic. Thank you, Rebecca. And I think you did kind of sum it up at the end, but would you recommend this as a career for others?
Yes, I absolutely would. Yeah, I think it's a really great career that I really enjoy. I think it's rewarding. I think it's challenging. It's really exciting learning about. I really enjoy, sometimes I come out of the sessions and really enjoy what I do, because I think actually you get the chance to be really creative. And I think it's a really great space for young people as well. Like sometimes, a lot of them will actually come to the session and they really enjoy that space, even though it's kind of, they're there to support their mental health. They enjoy coming to that space. And for them, it helps them to build up on their confidence and their social skills and lots of different things of learning as well. So yes, I would 100% recommend. Good job.
That's amazing. Thank you so much for joining us today, Rebecca. Thank you.
Absolutely. Thank you very much.